everyone, I just got done with my first week of rotations in PA school. This was a week of so much learning, so many surprises. All of my expectations were shattered, and I will be talking all about what to expect on your first week of rotations, what happened on my first week of rotations, and as I talk today, I will be hiking this beautiful hike that starts at Seven Seas Beach and goes to a beach called Playa Colora in Fajardo. So I was so nervous going into my first day of rotations. I didn't really know what to expect because they didn't give us many instructions. We were just supposed to show up at 8 in professional clothes with our coats. And I showed up at like 7:30. The building wasn't really even open yet. And then I went in and saw one of the secretaries. She told me that my preceptor secretary doesn't arrive until 8:30, so I waited until then. And then she was super nice, super welcoming, and then just showed me to a place to wait until the doctor arrived. And so kind of what I expected to happen the first day was just to be like shadowing the doctor, kind of like watching him, discussing cases with him a little bit. But they just threw me right into it. Like right away I was taking vitals and they said, "Oh, can you do an EKG on this person?" And I said, "Oh, well, we kind of learned how to do that in school." Like I knew the theory of it, but I never actually done it on a person before. So they showed me how to place the patches and the way that they like to do it in the office. And so that day I took like 3 or 4 EKGs. And so this week I've taken like maybe 12 EKGs. And so now I actually feel really comfortable with that skill, which is a really important skill to have. And I actually really enjoy doing the EKGs because that moment when you press the button and you get the printout, it's so exciting to see what it's gonna look like. And luckily for all the patients, so far everything's been pretty normal this week. So another thing I didn't expect is the very first day, I started taking full histories and interviews from patients in Spanish. So that was something I was kind of worried about, was communicating in Spanish. But I think I did pretty good. Everybody understood me, and his patients are super understanding, super kind people. So like, you know, nobody gave me any trouble. Some people asked me where I was from, but in a friendly way. And I learned a lot of Spanish vocabulary, which I'm actually gonna share, and words that were really important to know. There was this like popular TikTok like a couple weeks ago that my husband sent me that said like, "Oh, when you go to school to work in healthcare, but then you realize you hate people." And that is actually not what happened to me, at least not yet, because I actually really love talking to people all day, and I find everybody I meet so interesting, and I just love to hear their story. Also this week I started to get to do some examinations on patients, usually like focused exams for people who had a cardiac problem or some sort of complaint with their skin, and so that was a really valuable experience, and I look forward to 3 more weeks of that. One of the funniest things this week was watching how patients would come in, and when I told them that I needed to weigh them, they would take like everything out of their pockets to try to affect the weight. And I would just like laugh with them and say like, you know, don't be nervous, like everybody feels this way after Christmas. And it was just so funny. They would take like their keys out of their pockets. I was expecting them to take their fingernails off too at some points. But yeah, after a week of seeing patients, I think that I only had 2 maybe that were not overweight according to their BMI. And I would say every single person was worried about their weight in some way. So that's something that we all have in common. So it was a really long week, but I learned so much and it was so much fun. And by the end of the week, I didn't feel nervous pretty much at all anymore. So I'm really looking forward to doing this whole rotation, just learning as much as I can and getting to know some amazing people. And how amazing is it to be able to go on a beach hike on the weekend? I love living in Puerto Rico. So some of the most common conditions I saw this week were hypertension and diabetes. Obviously, we would all expect that. And then I saw a lot of people with kidney stones because my preceptor does a lot of pre-op clearance for people getting surgeries like lithotripsy and other kidney stone removal surgeries. I also saw a lot of people with hypothyroid. They were taking levothyroxine, and also a lot of people who had their gallbladders out at some point. One lesson I learned this week is how important it is to be, when you're interviewing, about real specific things. Like for example, there was a guy who was having abdominal pain, related to meals, and I forgot to ask what exactly he was eating in those meals. And so my preceptor said, you know, it's really important to ask exactly what they were eating. And so it turned out this guy usually gets sick after eating fatty foods. So that led us to think maybe something was going on with the gallbladder. And of course, you know, you have to order some imaging and tests to see if that's really what's going on. But that's something that I learned that was a really good lesson. Hi everyone, I came in early today to my rotation so I could share with you guys some medical terms in Spanish, and today I'm going to be going over some common symptoms that we see every day, and my amazing husband, Gabriel, who is a native Puerto Rican, is going to help us with the pronunciation. So some of the terms we're going to start with are chest pain,
dolor de pecho,
shortness of breath,
dificultad para respirar,
difficulty breathing at night,
dificultad para respirar de noche,
dizziness.
mareos,
Now we're going to do some common cold and flu symptoms, starting with the term flu symptoms,
síntomas de flu o gripe,
cold symptoms,
síntomas de resfriado. En Puerto Rico le decimos monga.
runny nose,
Secreción nasal o gotereo nasal,
congestion,
congestión nasal,
rash,
salpullido o erupción,
vomiting,
vómitos,
nausea,
náuseas,
diarrhea,
diarreas,
constipation,
estreñimiento,
excessive flatulence,
gases,
or stomach discomfort.
malestar estomacal,
Now to end with just some common neurological symptoms. Cramp,
calambres o cólico,
fainting,
desmayo o desmayarse,
tingling,
hormigueo,
numbness.
entumecimiento.
Okay, so we're gonna end with a couple examples. Tell me about your symptoms. Do you have any congestion or a runny nose?
¿Cuáles son tus síntomas? ¿Estás congestionado?
What were you doing when the chest pain started?
¿Qué estabas haciendo cuando te empezó el dolor?
Thank you all so much for watching. I hope you enjoyed this video. I really appreciate your support, so please remember to subscribe and share this video if you thought it was interesting. I hope you all are having a great week full of learning and adventure, and I'll see you next time.